Hi guys, what's going on? My name's Kelly, and today I'll be presenting stroke and brain injury. So what is stroke? A stroke is a loss of blood flow to a region of the brain. This loss can occur due to the buildup of atherosclerotic plaque in cerebrovascular arteries. So to start off, there are two types of stroke. One, which is the first one we're going to dive into, is ischemic, and the other one is hemorrhagic. So for ischemic, there's two types for that one as well. One is thrombotic, which is a clot that originates in the brain, and the other one is embolic, which is a clot that originates in a different location in the body but travels up to the brain and causes damage. An ischemic stroke can be caused by a condition called atherosclerosis, which artery walls thicken due to the invasive accumulation of white blood cells and plaque. This is a slow and progressive process starting in childhood, and it rapidly increases during your 30s. 87% of all strokes are ischemic, and possible causes include elevated levels of cholesterol and triglycerides in the blood, and high blood pressure, and cigarette smoking. On the left, you can see a picture of the arteries being clogged by plaque, which is atherosclerosis, like I mentioned before. Other pathways include the second form of stroke, which is hemorrhagic, and this is an excessive bleeding in the cerebral artery. And there are two types of hemorrhagic strokes. One is intracerebral, which is a hemorrhage that starts in the brain, and the other one is subarachnoid, which is bleeding between the brain and the brain tissue. There are two types of these weakening blood vessels. One is an aneurysm, which you guys might be more familiar with, and that's a ballooning or weakened blood vessel in the brain, which, if left untreated, may rupture. The second one is arteriovenous malformation, and that is a cluster of abnormally formed blood vessels that are at risk of rupturing. So some fast facts about stroke for you guys. Stroke is the number 5 cause of death in the United States. Nearly 800,000 people in the U.S. have a stroke per year, and more of those people are women than men. African Americans are more prone to stroke, whether that's the severity, the death of stroke is higher in African Americans, and also more strokes are caused in African Americans out of any other ethnic group. 1/6 of every male and female are at risk of potential stroke, and 34% of stroke victims are under the age of 65, which is interesting because a lot of times we see stroke victims come in who are in their elder years. But stroke can happen at any point in your life, and that starts in childhood, but as age increases, so does the risk for stroke. Some signs and symptoms to look out for is facial numbness or weakness, including limbs like your arm or leg, confusion, speech problems, and cognitive deficits, impaired bilateral and unilateral vision, impaired coordination and difficulty walking, and headaches. So, there is an acronym that you guys should remember, and that's called, and it's FAST. The first one is facial weakness. So, if somebody is showing signs of a stroke, one of those major signs is facial weakness. So, if you ask them to smile and one side of their face is drooping, then that's an automatic sign that something's going on that shouldn't be. And that's under the category of hemiparesis. The second one, A, is arm weakness. So you can test them by asking them to elevate both of their arms, and if one is more elevated than the other and the other one droops, then you can see that there's a weakness on the one half of the body, which is a sure sign of a stroke. Also, is speech difficulties. By asking them questions, trying to have simple conversations with them. If they're showing any speech impediments or difficulty trying to communicate with you, then you realize that it is time to call 911. And timing is everything with these severe health conditions, because the more time that is spent trying to figure out if they have a stroke, the more time that goes by where neurons are getting damaged in the brain. So what happens after a stroke? Some clinical considerations are medical professionals need to be aware of whether the stroke affected the left or right hemisphere of the brain. Some of these aftermath symptoms are aphasia, which is difficulty forming speech and communication, memory deficits, hemiparesis, which is the weakening of one side of the body, so like I explained, the facial drooping or arm elevation, and then there's hemiplegia, which is complete paralysis of one side of the body. So whichever part of the brain, say the left hemisphere got affected, then your right side of your body will be drooping, weakened, or experiencing paralysis. Another sign is spasticity, which is abnormal declining in muscle tone, and it's also hard for people to perform activities of daily living after going through a stroke. So what are stroke's response on exercise? There's an impaired autonomic control, reduced muscle fiber capillarity, abnormal glucose metabolism, abnormal insulin metabolism, reduced bone mass, and people who experience stroke are more likely to get fatigued faster due to the switch from slow twitch to fast twitch muscle fibers. So when diagnosing a stroke, you should always gather medical history information. This is crucial because you need to find out in the family if there's something in the gene line where you're more prone to getting a stroke. And that has to do with hypertension and diabetes and underlying coronary artery disease. Also, diagnostic testing, including CT scans, ultrasounds, angiography, and MRIs are included with the diagnosis of a stroke. So why exercise? What can exercise do for an individual who has experienced a stroke or is at risk of experiencing a stroke? It controls cholesterol levels by increasing good cholesterol. It fights high blood pressure by maintenance of blood vessels. It maintains weight, which can prevent future strokes from reoccurring. And also, you'll find out that something's interesting is when you first have a stroke, you are more likely to get another stroke. It also fights depression. Depression is common post-stroke. Strokes make it hard to move, let alone have motivation to move. And in most individuals, physical activity counteracts stress, and it allows you to be in a social environment where people may be experiencing the same issues, difficulties, and journey as yourself. Medication and maintenance. The first medication that we should be considering is exercise. Medications used are anticoagulants and antiplatelets and antihypertensiveness. An anticoagulant is warfarin, but usually most times that requires a lot of maintenance. So people are more prescribed to drugs that you don't need supervision over at a daily basis. An antiplatelet is aspirin, and these just help with blood thinning, so clots don't form. Surgery usually consists of an angioplasty, which is a balloon insertion. As you can see at the bottom of the screen, there's a picture there depicting that. It's a balloon insertion which compresses the plaque and allows a stent to be used to open up the artery and pushes the plaque against the walls and allows a free vessel for blood to flow through. Also, physical therapy, which helps to restore coordination and movement. Occupational therapy, which helps people return back to independence and activities of daily living. And then there's speech therapy, which reintroduces clear communication techniques, can all play a huge role in stroke recovery. Some risk factors to be aware of is age as it increases, family history of coronary heart disease, hypertension, etc. Race and ethnicity, as I mentioned before, African Americans are at a higher risk than any other ethnic group. Gender, women are at a higher risk. Low physical activity, so a sedentary lifestyle, poor diet choices, diabetes and obesity, tobacco use, high blood pressure around and above 140/90 millimeters of mercury, and blood lipid profiles including LDLs, HDLs, and total cholesterol. So, when I did my case study, I'll just explain the background of it. The details were the patient was 61 years old. He was a male. He suffered from a stroke 1 month ago. He was around 5'10" and 192 pounds. He smokes cigarettes. He's a current smoker and only performs physical activity when he's gardening outside and walking around the block. He was used to driving and living on his own with his 2 cats, so he's very independent. So this could also be a struggle with depression because it affects people when they can't do the things that they were once able to before stroke. When I was talking to him, he presented cognitive impairments such as memory loss, difficulty speaking, and a weak left side of his body. His LDL level was at 150 milligrams, and then his HDL level was at 48. His BMI was recorded at 24, which is pretty good, and his blood pressure was at 144/96, which could definitely use some work. So for risk stratification, his age was a problem. Tobacco use was a problem. Sedentary lifestyle, not getting enough physical activity, gardening, or walking around the block was a problem. His LDL level was an issue as well. And then his blood pressure was way too high, or I guess a little bit overboard. And his stroke took place 1 month ago. So I would say this patient is at a high risk due to the total CVD risk score of +5. So some of his goals include improving overall quality of life, exercising more consistently, whether that's joining a gym or having another partner to walk around the block with under supervision and being able to do that a couple times a day, quit smoking, and he does dip on occasion, and improve strength and coordination. So an exercise prescription that I relayed to him was aerobic training. Is very important. So I'd say about 3 days a week, intensity 40 to 70% of max heart rate at a light or moderate progression. So we want to start out slow, especially if 15 minutes doesn't work out for them, then 10 minutes a day will do. Just as a gradual progression, they should be making their way up to 30 minutes. 10-minute increments also might be appropriate for some individuals who are having extreme and severe deficits. A type of aerobic training would be walking, water aerobics, jogging, step classes, and stationary cycling. Because of poor coordination, we don't want them on a bike, or I don't want my client on a bike just because he's at higher risk of falling and injuring himself. And also household tasks. So keeping up with his gardening and maintenance around the house could also be helpful for him, and it suggests a form of independence. And we also need to be conscious of blood pressure and heart rate during exercise. Also, I prescribe resistance training 2 or 3 days a week. The intensity should be around 60 and 80% of his 1 rep max, and it should be a low and moderate progression as well. Time should be around 30 to 45 minutes unrushed a day, and around 8 to 12 reps for 2 sets. The types that he should start out with are a resistance band and machines, and then he should progress to free weights, because we don't want him to initially go to free weights because of poor coordination and deficits, whether that's visual impairment or a weakness of one part of the body or half the body. We don't want him falling or dropping the weights and injuring himself. Also, flexibility and balance could also help in activities of daily living. So I said a frequency of 3 days a week, and then the intensity should be below discomfort level. So we don't want him feeling uncomfortable at all or feel like he's hurting himself or injuring himself anymore. The time should be hold each stretch or posture for about 12 seconds, and I usually say 12 because when people count to 10, they usually rush through it and don't get enough of a stretch. And types can include yoga, tai chi, walking, and wall support poses. So leaning up against a wall could also help, especially stretching lower extremities and back. This can also be beneficial to him because it can control his blood pressure and help him maintain his balance, which can help with coordination as well. So my final thoughts for you guys today are the first 6 months of rehabilitation are absolutely crucial, and is also when the most recovery occurs. And I learned this at Bryn Mawr Rehab Hospital, where I'm doing my internship. So I have professionals that keep reiterating this to a lot of the patients, because it's hard for them, as I said before, to grasp that motivation to get up and do the physical, occupational, the speech therapy, the psychology testing, cognition testing. So that is very important, especially in the first 6 months. Exercise significantly reduces risk of a reoccurring stroke. So as I mentioned before, when you do have a stroke, you are at a much, much higher risk of getting another stroke, which in recent studies that's become more prevalent, and they're looking into that. Aerobic exercise, balance and flexibility, and resistance training should all be utilized in the exercise regimen. And this can help with improving daily life